Hello and welcome back. This video is on Medicaid, and I'll try to abbreviate a little bit since we did so much in Medicare. I'm also going to try to incorporate some other videos, and I have to apologize because I'm recording this one directly to the computer and I'm not using the microphone. So let's go ahead and get started. You've already watched this video, so you're already familiar with the history of Medicare and Medicaid, and you know that Lyndon Johnson is the president that signed this into effect. In today's video, I'm going to insert two videos, one at the beginning and one at the end, that I downloaded off of YouTube. And the first one comes from the Robert Wood Johnson Foundation, and you should be familiar with them. That is the United States' largest philanthropic organization devoted solely to the public's health. Also, I'll pull a couple questions there. You may be asked, who is eligible for Medicaid? So the first video is very short and simple overview of Medicaid, and then I'll go through the PowerPoint slides from there.
Medicaid is expanding?
It's true. More uninsured Americans will be eligible for Medicaid, a health insurance program that provides coverage for people who can't afford it on their own.
Like who?
Low-income, disabled, and elderly Americans who count on Medicaid to get the care they need. Many states are expanding their Medicaid programs so that a family of four earning roughly $30,000 or less and individuals earning approximately $15,000 or less a year will be eligible.
So, more people in need will have health insurance?
About 14 million more.
When will this happen?
Some states are starting in January 2014, but other states may decide to expand their Medicaid programs later. Each state is different, so the process might not look the same for you as it does for your neighbors.
Great. Happy I asked.
Welcome back. The video gave you a little understanding of some of the expansions that are going on in Medicaid that are slated to start January 2014. The first part of this slide was covered in the video. The second part you need to have an understanding of, and that is how states and federal Medicare spending is calculated. So it's the state income squared divided by the federal income squared times a multiplier, and that multiplier in this case is 0.45. Sometimes you'll hear that multiplier called FMAT, or the Federal Medical Assistance Percentage. So after doing the calculations, you'll get anywhere from 50 to 83%. So if we look at the high end for a state with a ratio of 0.83, the federal government would pay 83 cents and the state would pay 17 cents on every dollar of Medicaid spending. This slide and the book go over some of the eligibility categories, and it's usually based on the FPL, or the federal poverty level, and it's based on a percentage up or down from that level. The other index reference here is called the SSI, or the Supplemental Security Income, which is for blind, elderly, and disabled. It's often used for nursing homes, hospitals, extended care, if an individual has income below 300% of the SSI limit. This slide covers some of the Medicaid services and would be a prime target for a quiz question. This slide duplicates what we saw 2 slides ago, but notice the percentages based on the federal poverty line. Again, prime target for a quiz question. Alright, so now we're on crowd out. We've already talked about crowd out once before, but in this particular case, they're talking about Medicaid crowding out private insurance companies. The crowding out of private insurance by Medicaid should be a concern for all of us. Think about it this way. Healthcare costs are rising. Healthcare costs are becoming a greater portion of the gross domestic product. And so who's on the hook? The government has to pay all these healthcare costs. So, in our book, these two authors ask some very poignant questions. What is the reduction in terms of private insurance? It's saying that 22% of the increase comes from Medicaid coverage. What is the share of decline of private insurance? About 15%. You should be familiar with the state children's health insurance plan, which basically it's just matched federal funds for health insurance for lower income children, again based on the federal poverty line. One of the underlying reasons that this program came into effect is that many thought that Medicaid was stigmatized, meaning that people didn't want to say that they were on Medicaid. And so what happened is they felt that children weren't getting the services that they needed. So in another article in your book, these authors talk about how to deal with some of the crowd out. And so it says that some of the crowd out where private insurances may have been dropped, they may have been picked up by employer-sponsored insurance. It suggests reducing the wait period to help reduce crowd out, that if you have a shorter wait period, people are more apt to take on insurance, or the take-up rate will be improved. And finally, premium sharing also reduces crowd out. Okay, we're coming to the end, and I'm going to insert a video from the largest provider of actuarial services. This company would compute premium rates, dividends, and risk. I usually don't add a for-profit video, but this company took a very neutral stance and did a very good job explaining Medicaid. Go ahead and get started.
Medicaid is a U.S. healthcare program that finances the care of low-income and certain high-risk populations, including low-income children and families, people with developmental or physical disabilities, low-income nursing home residents, and others. Unlike Medicare, which is a federally funded and administered health insurance program available to everyone over 65, regardless of income, Medicaid is a need-based program funded jointly by the federal and state governments and administered at the state level. In 2009, Medicaid financed the care for nearly 20% of all Americans, making it the largest source of medical coverage for the country's low-income population. In the coming years, under the Patient Protection and Affordable Care Act, Medicaid will expand to cover a much larger proportion of the population in certain states. And yet, despite the growing importance of Medicaid, most Americans do not understand how it is funded. Medicaid begins with a mix of federal and state funding. The federal government makes annual Medicaid payments to states based on their federal medical assistance percentages, or FMAPs. Each state's FMAP, which is determined by a formula that looks at state per capita income relative to the U.S. average, is set somewhere between 50 and 83%. This means the federal government pays between 50 and 83 cents of every Medicaid dollar, leaving the state to pay the difference. While the proportion of federal and state dollars is set each year, the total amount is unlimited unless the state and federal government have agreed to special financing terms under a waiver of the Medicaid rules. These funds can be further supplemented through a number of different federal grants. A state may use alternative sources of income, such as tobacco or provider taxes, to fund its Medicaid program. This accumulated pool of healthcare money helps to fund the populations in a given state. If people have other sources of healthcare funding, such as Medicare or employer-sponsored insurance, those parties may have to provide funding before Medicaid, since Medicaid is a payer of last resort. While the federal government has mandated legal minimums for Medicaid, including minimum access to care, eligibility requirements, and medical service requirements, there remains great flexibility from one state to another in how programs are administered. One of the ways states utilize this flexibility is through waivers, which allow for expanded services and enrollment, and in some cases allow innovative solutions. Each state establishes the reimbursement rate that will be paid to hospitals, physicians, pharmacies, and other healthcare providers. Medicaid reimbursement rates are typically lower than those paid by Medicare and commercial health insurance carriers. While most Medicaid payments are made to providers based on the services performed, other financing components sometimes complicate the picture. These may include special payments to providers that provide care to a high number of low-income populations, rebates paid from the pharmaceutical companies to state and federal government, or clawback payments made by the states to the federal government to offset the cost of prescription drug coverage offered under Medicare Part D. Adding another layer of complexity, the Patient Protection and Affordable Care Act will expand Medicaid to a larger percentage of those who are currently uninsured, as well as to other low-income individuals. The Medicaid expansion population will be paid at 100% by the federal government for calendar years 2014 through 2016. However, this federal contribution decreases over time, with the federal government paying 90% and the states paying 10%, beginning in calendar year 2020. In addition to expanding Medicaid coverage to new populations, new financial requirements for both state and federal governments will add to an already complex system that is projected to grow to more than $900 billion by 2020. To learn more about Medicaid and other important healthcare topics, visit milliman.com/HCR.
Okay, I think they did a good job on that video, and hopefully you have a better understanding of how Medicaid is funded and have a feeling for the expansions that are coming up into the year 2020. Better understanding of waivers and rebates and clawbacks. Think of clawbacks as a way to cover some of those donut holes that we talked about in previous chapters. So, let me close out and thank you again, and I'll see you on the next video.